Come in.
Hello, how are you?
Hi, I'm good, thank you.
Oh, good. My name's Sean. I'm your nursing assistant. Do you mind if I check your ID bracelet?
Sure.
All right, Miss Teresa, hi. What I'd like to do is take your pulse. Would that be okay?
Of course.
All right, great. Let me wash my hands and I'll get started, okay? There's your call bell if you need me. At this time, I'd wash my hands using proper technique, and when I return, I'm going to don my gloves. Anytime I place my gloves on, I'm thinking about the resident's privacy. Miss Teresa, do you mind if I shut your door?
Oh, please, thank you.
Okay, that way we'll have a little bit of privacy here while we take your vital signs. All right, now I'm going to gather all of my supplies. I don't need much for this. I can see my documentation, my recording and measurement form for pulses here with a pen, and I have a clock with a second timer. At this time, I'm going to go ahead and position the resident's arm. You're always going to support the arm. Go ahead and find the thumb line and run your fingers down the thumb line onto onto the wrist and move slightly inside until you find the radial pulse. Once you find the radial pulse, and she has a really good bounding radial pulse that I can feel, I'm going to mark my time on the clock, which is 10:18 and 30 seconds, and I'm going to start counting now. I'm going to count for 1 full minute. The normal pulse rate for an adult is 60 to 100. And now that 1 full minute is up, I'm going to remember that time in my head and take care of the resident and then document appropriately. Miss Teresa, are you comfortable, or can I adjust the head of your bed?
I'm fine, thank you.
Okay. The bed is in its lowest position, and she has her call bell right here. Miss Teresa, let me give you that. Now I'm going to go ahead and document. Her pulse was 68. And I'm going to sign it. Miss Teresa, do you mind if I open your door?
No.
Okay. Now, at the end of every procedure, we at Advanced Clinical Training strongly encourage you to stop and take a look around the room and do a post-procedure check. In this case, she has her call bell. The bed's in its lowest position. The head of her bed is where she likes it. I've already checked. I've recorded. The door's open. So at this time, I'm going to deglove. All right, Miss Teresa, I'm going to wash my hands. If you need me, give me a call, okay?
All right, thank you.
All right, I would wash my hands using proper technique and return to the room and announce to the nurse aide evaluator on test day, end of skill.